If you have boobs, you need to listen to this episode of Sarah Has Questions because we're talking about everybody's favorite medical test, the mammogram. Oh, yeah. Why do you need to get a mammogram? How often should you get a mammogram? And most of all, what happens when you get that scary callback for a follow-up? It's Breast Cancer Awareness Month, and we are talking about it right on time. Let's get into it. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? Will popping a knuckle or a joint give us arthritis? What can we learn from our poop? The size of your body doesn't necessarily indicate your measure of health.
Yes.
And what are your thoughts on that? Cleansing. Do we need to do anything special to our nether regions? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. So today I have two professionals with me, Dana Knapp, who is an imaging manager with WakeMed, and we have Adrienne Jackson. She's got a longer title, Certified Breast Imaging Patient Navigator, which sounds very important. I won't have you explain exactly what you do. I want to jump right in because this is a very pertinent conversation. Let's start with prevention. We're talking breast cancer. What are the guidelines on mammograms? Because I know they've changed recently. How do they change? Where do they start and where do they change?
First of all, every woman should have a conversation with her medical provider about that. Talk about your breast health at every visit. But we recommend annual screening mammography for women starting at the age of 40. From that, you go to if you are high risk, so which we'll get into more. But if you are deemed a high risk patient, that's a conversation with your provider. Decide what screening program you're going to follow. It could start at a much earlier age. It could involve MRI. It could involve ultrasound. So,
well, you said talk about your breast health. What do you mean by that? Because I mean, like they're there. They
right.
still good. They haven't fallen off yet.
You're right. So believe it or not, your breasts are always changing. They're a living organism. They're always changing. The breast density is going to change. The composition of your breast. You always want to, if you feel something that doesn't feel right, or not being afraid to say to your doctor, hey, I feel this lump under here.
Okay.
It wasn't there a month ago, or I'm having some nipple discharge. They're going to ask you questions about that. But that's so important because then they're going to recommend what you do from there.
Yeah, I'm sure it's scary to people.
Yep.
To mention, like, especially if I had discharge coming out of my nipple, I'd be like, oh my
Right.
gosh, that's scary. And you might not want to mention it, but it's really important that
really
you do.
important. Yeah.
All right, Adrienne, I'm going to ask you this. I'm going to make sure I say your name so people who are listening can just sort of differentiate you. I was told when I got my first mammogram many moons ago that I have dense breasts. And I was recommended to have a 3D mammogram. Is that, first of all, what does it mean to have a dense breast? And secondly, is that still the case that dense breast people should have a 3D mammogram?
Yes, that's correct. That all dense breast and non-dense breast
Everybody.
patients should have.
Everybody should have 3D.
Everybody should have it. It's like the gold standard now.
It's our standard of care at WakeMed. We only do 3D.
Okay, great. That's wonderful.
And which it means it's like you have more fibroglandular tissue than fatty tissue.
What does fibroglandule mean?
It's just the composition in your breast
Okay.
shows, in an image, it shows white.
I see.
That's what we call dense. And then fatty is kind of in the gray tones in an image.
I see.
So, yeah.
Yeah, and so that the importance of the density is that because it's like that cloudy
Yeah.
white, it makes it harder for the radiologist maybe to see something, especially a smaller cancer. But that's the great thing about 3D. The beauty of 3D is the 3D technology, for people that don't know, for the radiologist, it's almost like they're reading a book. They can flip the page and see each in between rather than just looking at the side of a book.
I see what you're saying.
If you want to use an analogy or whatever. So they're able to see through those dense layers with 3D.
I see.
Much better.
So while they developed this 3D mammogram, did they decide to make mammograms less miserable?
That would be asking too much.
I'm like, they run on par with copy machines,
Right.
which they still break down and are massive. I mean, I feel like I've made sweet love to a machine by the time I leave a mammogram.
Yeah, it is.
But it's important to do, and
right. You do the compression is a little less.
Yes, it's a
It
little
is
less.
Okay, well that's good.
is,
We're
yeah.
making progress.
Yes.
We are. Yeah.
So I've also heard, and especially when I was in college, that caffeine can affect your breasts. Is that true? Like, because I was told that you should, that it can cause cysts. I was also told that like when you get a mammogram, it might be a good idea not to have caffeine.
Right.
Is this all myth or what?
I mean, as far as the caffeine goes, I don't think it changes your breast composition.
Right. Okay.
But if you do like an excessive amount of caffeine, it could create cysts or even pain.
Right.
But not
Why?
everybody. Hormonal, it can change your hormones a little bit. But I mean, that's if you're like excessively drinking caffeine. I mean, one a day, it's not going to affect anything.
It's like drinking a pot.
Right. But they
Yeah.
do say that.
Yeah.
They still do say, limit your caffeine intake. You
Yeah.
could take a Tylenol before a half hour before you get there. That
Yeah.
might help.
Yeah.
If you are very sensitive to the pain.
Well, and also I know that you being on your period, they're
Oh, yeah. If you have pain prior to your cycle, you may want to refrain from getting
Yeah,
it
I've only
until
done
after.
that once. I didn't know, and I was like, "Holy cow, this
Yeah.
is a totally different ballgame."
Yeah. Usually
sensitive.
wait like 3 to 5, just wait a week after
Yeah.
your period to schedule your mammogram. That's going to be the most comfortable.
Yeah.
Comfortable.
Yeah, I always feel bad because I have rather big boobs, and the women who don't have much. I mean, how do you even get enough skin to do a mammogram on a woman with smaller breasts? I just feel so bad for them.
Yeah, it is a little harder, but some women won't get their mammogram because they think, oh, I have small breasts.
Oh, is that true? Oh,
and
that's
so,
not smart.
No,
No.
they still need to have their mammogram.
Should men? Because I know men can get breast cancer. Should men be getting mammograms?
Only
yeah.
if they feel something,
Okay.
or pain, lump, or anything like that, they should talk to their provider, and then from there, they usually get what they call a diagnostic mammogram.
What does that mean?
It's more in depth as far as extra images. The radiologist will look at it that day. They may do ultrasound while they're there, so it's a little more comprehensive.
But do they get squished?
Yes,
Yes,
they do.
Okay, so let's talk about what you see in a mammogram. What exactly are you looking for? I know you're looking for cancer. What else can you find in a mammogram?
I mean, you can see masses. You can see what they call calcifications. It looks like white little specks of like salt in there. They look for spiculations.
What is that?
It's like a webbing, I guess you could say,
Yeah.
in an image. It can start from like a mass and it webs out a little bit. They can see, what else? Lymph nodes. They
Okay.
can see.
See a
Some
lot of
people have
lymph nodes.
pronounced lymph nodes. Some have lymph nodes that kind of reach further into the breast tissue. Vascular.
See a lot of vascular.
Yeah.
Vascularity.
Can you diagnose other things besides cancer by looking at a mammogram?
Not so much diagnose, but recommend for further,
Like what?
usually further imaging. I mean, if they see
like
a
enlarged
lymph
lymph nodes
node
that are enlarged.
or they see something in a vessel,
Okay.
That
isn't-
calcified?
yeah,
Yeah.
then they can recommend you to follow up with your provider and maybe get additional imaging.
Okay. I know that in health class, I was taught how to do a self-breast exam. What do you tell your patients about or your clients about self-exams?
I mean, definitely it's best doing it in the shower. Well, probably prior to that, look in the mirror. Make sure you see your breasts. Make sure you don't see anything out of the ordinary just by looking at them.
Okay.
If one's starting to get bigger than the other or out of nowhere, or an inverted nipple that just like all of a sudden happened or anything like that before you actually do like the manual exam.
Okay.
When you're in the shower, it's easier to kind of glide. That's why they tell you to do in the shower, to
okay.
glide around either in circular motion and in like coming from the outer to the inner or through quadrants like a pie.
Yeah. Yeah.
Pieces, outer, inner. You're looking to feel like anything out of the ordinary to you. That's why you should do it every month to make sure, okay, that wasn't there before,
Right, to
and now
know.
there's something there. So that's
Right.
why it's good to get to know your breast.
Yeah, well, you
Yeah.
should. Yeah. It's like almost,
Yeah.
it's your body. You have to take care of it. No one knows it better than you do. What are some of the regular things we should be doing aside from mammograms and self-checks? Is there anything?
Your provider as well should do a clinical breast exam as well, so they can feel.
But also, like, lifestyle is very important in the prevention of any cancer, not just breast cancer,
Right.
but any cancer. Exercise, what we eat, staying at a healthy weight, the amount of alcohol you consume.
I feel like that is
We
that a
say
hard one
that.
for you?
We say that.
I enjoy wine. My husband sells wine, so we have a
but
lot.
there you go.
I had like a $200 bottle of champagne in my fridge on a Tuesday last night. I didn't pay
I'm coming
for
to
it.
your house.
You should.
But you should, everything in moderation.
Moderation, yeah.
Yes.
But, exercising, all the same things that we would say you should do for
Heart
your
health.
overall
Yeah,
health,
yeah,
heart
yeah.
health. You want to do, they will affect your cancer risk as well.
I see.
Your breast cancer risk as well.
Okay.
Yep.
What about genetics? I know that there is a certain gene that people can have. Talk about genetics in breast cancer. Because I always am asked, does your mom or your sister, which I don't have, but do they have breast cancer? And mine has always been no. But what do you tell people?
If you have like primary or like close relation, like family that has breast cancer, mother, sister, maternal grandmother, then your provider will probably like, okay, let's get some genetic testing to see if that's what's related or not. And they usually test, like the most common ones are BRCA1, BRCA2.
Okay. And those are
Mutations.
genes?
Yes.
Okay.
Mutations to see if you are positive or negative for that.
And if you're positive for it, is it like a guarantee that you're going to get breast cancer?
No, still no. Yeah.
Okay.
No.
That's good.
Yeah.
You're considered now high risk, but as far as I don't know.
Increase it.
Yeah.
You're at higher risk.
Yeah.
But it doesn't mean you're going to have
Get
breast
it.
cancer.
Do you know why you're at higher risk when you have that mutated gene?
Because it is a mutation that they've shown is
Correlated
correlated
I
to
see.
breast cancer. So that there again, that's then a discussion with the genetic counselor and your provider. Where do I go from here? Should I increase my surveillance?
Yeah.
Right?
Yeah.
Should I have more testing more frequently? Do a risk assessment, which Adrienne performs those. It's a series of questions, tells you what is your risk. Do you fall in a category where you need to start having those conversations and come up with a different strategy, game plan?
You can't follow the guidelines
The
for
recipe,
everyone.
right.
Yeah.
You're gonna have to follow a different set. After a mammogram, this has happened to me once, and it was terrifying. I got a phone call, and it was just like, "We saw something in your mammogram. We need you to come back in." I know it happens, but I want you to tell everybody what's the next step when they think they may have seen something.
Usually I would contact the patient to schedule them, but they become a diagnostic mammogram at that point, which means you come back, you do additional imaging, extra pictures, and then the radiologist is there. They'll look at it, see if you need to do more pictures while you're there or ultrasound while you're there. They look at all those imaging that they had done that day, and then they decide whether let's just follow it. I don't think they're deemed to be needed to biopsy yet, or everything looks fine, just come back in a year, or I think it needs to be biopsied.
Yeah.
And then a biopsy means going in, cutting out tissue, and
It's just more sampling. Yeah, they
Yeah,
sample
I
at
see.
this point. Yes,
Yeah.
yes.
And going back to the 3D, and because it's happened, when you get called back, you get very nervous right away. You think I have breast cancer.
Yes, 100%.
And so I think something that women might not know is if they have never had a 3D and now all of a sudden they were to come to Wake Med and have a 3D mammogram, they're going to see things they haven't seen before
Things
in
look
your previous imaging. So they may call you back.
That's good to know.
Yeah. And so it's probably nothing.
Yeah.
It's just that a radiologist is always going to call back anything that isn't seen in the previous imaging.
Yeah.
I was being overly cautious.
Yeah.
Which is good. Yeah, I want overly
But that will
cautious.
happen in that switch from 2D to 3D.
I
So
see.
women should know that.
Yeah, for me,
yeah.
it turned out to be just two fat cells on top of each other. That's
Right.
what they
Isn't it?
said.
Don't you love it? It's like, when you have a fat containing tumor. Yeah, it's lovely when you hear that as a woman.
I was like, oh,
You're like,
I've got fat everywhere.
And same with baseline patients as well. Those don't have any priors. This is your first mammogram. We don't know what your breasts look like
That's
prior
true, too.
to.
Yeah.
So
That's true, too.
more than likely, a lot of them get called back.
right. Yeah. And with those callbacks, like, the anxiety
Oh, it's awful.
of all of it, that's where somebody like Adrienne is great.
So, like, any
patient
questions they
navigator.
have,
Questions, alleviate the fears, really explain. And also the nagging phone calls maybe that women get saying, we need your previous imaging. We need you to send those from, say you moved from California.
Yeah.
We really need to get those.
Yeah.
That's why it's so important.
Yeah.
We don't want to have to call you back. And
yeah, you get the phone call like, oh,
Right,
God, I'm
right.
dying.
So-
Yeah, because that's what you think. It's the
Right.
first thing you think of. You
Right.
see all the,
Yep.
the pink ribbons, and you hear the
Yep.
stories, and you see the walks, and you're like, I don't want to be on that train.
Exactly.
Yeah. All right. Well, let's say you end up having breast cancer.
Mm-hmm.
What are the types that you can have?
Oh, there are a
Well,
lot.
yeah.
Well, I guess, if there's how many?
The not good type.
Well,
Yeah.
the most common that I have seen is ductal carcinoma in situ, which
Okay.
is DCIS,
Okay.
which in terms means is still confined within the duct.
Okay.
It's usually categorized like stage 0,
Okay.
but it is a cancer.
I see.
And then there's invasive ductal carcinoma
Okay.
that has invaded already outside the duct, but there's different stages of that as well. And there's invasive lobular. It's within the lobe of the breast. Within
Gotcha.
And then I'm trying to think of the other ones that I've seen.
What about metastatic? I hear about.
Yeah.
Well, that's usually if there's some pronounced lymph node, they'll biopsy that as well. If there's something seen in the breast, and that could be metastatic.
What does
'Cause
metastatic
it's
mean?
spread.
It has spread.
okay.
It has spread now through the lymphatic system.
Which is very scary. Can
It
be.
increases,
can be.
Yeah.
I know you
Yeah.
can't say. You're
Can
like,
be.
Yeah.
these people are listening. And
Yeah.
I mean, that's why it's so important to, if you feel that lump, you have any concerns, why you address it. The earlier it's detected, the less chance that it will spread to the lymph.
Well, and it sounds like, and correct me if I'm wrong here, but like with colon cancer, it's a very treatable cancer.
Correct. Yeah, it used to be a death sentence.
Exactly.
In my lifetime, I can remember when I was young, if a friend of my mom's was diagnosed, you were like, oh no, she's going to be gone, right?
Yeah.
Now, it's very rare to hear that somebody
Which
passes
is
away, which is wonderful.
Yes.
It is wonderful. There's so many new targeted therapies. Precision medicine has come into play. We now have better surgical techniques. There's robotic mastectomies in some places, 3D imaging, what that's done. So the advances have really made this, like you say, like colon cancer.
Yeah.
It's so treatable, which is so great.
And the earlier you catch it, the more
Oh, yeah,
treatable
that's
it
key.
is.
That's
Which
key.
is that,
Yes.
and that's how colon cancer works. Like
Yeah.
if they see it, they just cut it out, and boom, you're all good to go.
Yeah.
Okay, can you explain the different type of treatment options once you have cancer and you have to deal with it? What are your treatment options for the cancer? I'm sure it would vary with the type that you have.
Yeah.
Yes, yeah.
There's chemotherapy.
Yeah.
There's
Radiation
radiation
therapy.
therapy. There's surgical, as far as you can get a lumpectomy or a mastectomy.
Mm-hmm.
There's even hormonal based type of therapy, depending on if your cancer is hormonal based, if it's estrogen, progesterone positive.
Right.
If that means that it's feeding off of that hormone.
Right.
So now there's therapy that kind of blocks those therapies to stop the growth of the cancer.
So you cut out your estrogen and it stops feeding it.
Yes.
What else would a cancer feed on if it's not a hormone? Do we know the answer to that yet?
There's, I would say that's not our wheelhouse as much, but I will say once, with treatments, Adrienne will navigate a patient who is diagnosed with cancer to our oncology, surgery and oncology services at WakeMed. And then, like I was saying before, there's so many treatments now. There's so many clinical trials as well.
What do you mean by a clinical trial? I hear that all the time. I'm not real sure what that means.
Yeah, clinical trials are when there is a new treatment or a drug, maybe even an imaging technique, and yet it hasn't been FDA approved yet, or it could be FDA approved, but hasn't been put into clinical practice. But they have seen great results, and it's usually if other things aren't working.
I see.
Yeah.
Well, that actually
Yeah.
segues me perfectly to my next question, which is what are some latest developments that have happened for breast cancer, like in treatment?
There's so many all the time, and like I said, a lot of clinical trials, but it's more those, breast cancer is very individual.
yeah.
It's
So hard to
you.
say.
You and I could be diagnosed with the same. We could both have invasive ductal carcinoma, but mine could be completely different than yours.
That's so crazy.
Yeah. So
Different
just-
stages.
different stages, different the hormonality of it, the who we are as a person, comorbidities, everything.
What is comorbidity?
Lifestyle.
Lifestyle.
Or
Okay.
do you have other do you have diabetes?
I see.
Do you have
Yes,
anything else going on? So that's going to dictate what your treatment plan is going to be, or
I
what
see.
treatment will work for you. But now there's so much more with the targeted therapies that are, they're created to you.
I've been hearing about
They're
this.
developed for you individually
Yeah.
with your oncologist. So amazing outcomes.
I keep hearing from numerous doctors, especially this season. This is the third season of this podcast. Thank you, WakeMed. That personalized medicine is getting more and more. They're just making more advances in that direction because everybody is so different. I think and so they're doing that in
amazing.
breast cancer. It's awesome.
Yeah.
It's absolutely awesome. What resources are available to a woman who's diagnosed with breast cancer? Because I know if I was diagnosed, I would freak out. What are what do you do to support a woman who's going through breast cancer treatment?
I mean, I can be one of their support person. There's Susan G. Komen website as well. The American Cancer Society as well. Even their provider, oncologist, surgeon. They also have navigators as well that can also help with anything, whether it's
when you're a navigator,
insurance, transportation, anything like that. Any question, doesn't matter.
You can
We
help
should,
them.
yes. I'm like, if I don't have the answer right now, I will find it for you.
That is awesome because that's like, especially in America, that is one of the worst things is thinking about navigating insurance and all that stuff.
Yeah, and we're trying to, get that away from them and let them focus on just their health at the moment and have everything else kind of with the navigators to figure out.
So if a woman comes to you like I would, freaking out, what are some things that you would tell her?
Well, I mean, because I'm the one that tells them whether they have cancer or not. I'm the bearer of bad news.
Oh my God, I don't know how you do
and
it.
then, of course, the first question they ask me is, "Okay, what stage am I?" And this, that, and that. And I tell them everybody's different. Everybody has their own type of treatment plan based on their pathology, their imaging, and what the surgeon or oncologist feels is deemed as necessary for you.
Okay.
You hear it all the time, but advocating for your health, like your oncologist, your surgeon, depending on what your cancer is, ask the questions. They want you to know everything. They want you to be part of your, we have fantastic breast surgeons. We have fantastic oncologists. They really want you to be part of every decision about your care, and you should be.
Yeah.
It's your body.
Yeah.
And they want you to feel completely confident and
Empowered.
assured. And because the more, knowledge is power, right? The less stressful the whole process is going to be. And stress is key, to healing. And so really encourage people to, talk to Adrienne and anybody in your community. There are community support groups. There are church support groups. There are neighborhood support groups of women who have had breast cancer. Reach out to somebody went through that.
Yeah. All right. Let's get into our listener questions. I love these. All right. First one, and I have heard this. Does wearing underwire bras increase the risk of breast cancer?
No.
There's no scientific evidence that says that. It's probably something that they've heard somewhere and just assume.
Yeah.
I mean, it may be uncomfortable.
Yeah.
It may even cause some pain.
Yeah, but they won't cause cancer.
It does not cause
That's wonderful. How about deodorant?
No. Well, they say aluminum, but actually for us, when we say no deodorant as far as for a mammogram, it's because they can show up in the mammogram.
Oh, because there's metal in it.
Yeah.
That makes sense.
But as far as the whole cause cancer,
There's no
evidence.
Yeah.
Got it. All right, next question. I typically think of people finding out they have breast cancer from a mammogram, but are there symptoms other than lumps we should be on the lookout for?
Yes. Like Adrienne said, if you see a dimple in your skin, your skin can all of a sudden invert, or an inverted nipple or nipple discharge, pain, and the pain should be, you can have pain in your breast around your cycle, everything, right? Yeah. But this would be pain that's very focal. It's in the same
and it's
place,
new.
and
Never
it's new,
happened
and
before.
and it usually intensifies, and it's pretty constant.
I see.
That would be a pain that you would say, I better have this checked out.
Okay.
Yeah. So there are other things besides a lump for sure.
Okay.
Yeah.
All right. Do people with bigger boobs tend to get breast cancer more often than people with smaller boobs?
No.
No, it has nothing to do with size. No. Not at all.
Okay. You would think that the bigger there'd be more chance, but okay,
No.
interesting.
No.
You know, like more real estate.
No.
Does breastfeeding help prevent breast cancer?
So yes, breastfeeding is good. Again, something that's great overall for everybody. But there are studies that show that breastfeeding is beneficial for all things with health and just keeping all those hormones doing what they should do.
Yeah.
So, yeah.
Okay, that makes sense.
Yeah. But I don't know if there's like a
Direct correlation.
Yeah.
All right, last question. Is there a trend of younger women being diagnosed with breast cancer? It seems like I'm hearing about young women having it more often.
Unfortunately, yes.
Do you think it's because the detection is better?
There's that. I think there's hormones. There's
environmental. It's just a lot that could factor into it.
Yeah. That's the thing about cancer. It's like we don't really know what's causing it.
Yeah.
All right.
Yeah.
Well,
sadly,
this is a case of mostly good news, though, and that's fantastic. I was a little nervous doing this episode, because it's breast cancer.
Right.
But I mean, all these walks and all the effort we've put into getting more research really has come up with some great results.
Oh, it has. Yeah.
All right, guys, got to schedule those mammograms. There's nothing to be afraid of. Even if you do get a call back for a follow-up, there's really no reason to panic. This is one of the best cancer screening tests we have. Knowledge is power. My guests today were Dana Knapp and Adrienne Jackson. You can find out about WakeMed's breast health services at wakemed.org. Please share this episode with someone who needs to hear it. Hit that share button on your podcast player and pass it on. See you next time.